ladies, it's Barbara and I am your menopause drama mama. Today I am talking about all the changes our breasts go through after we hit perimenopause. And I shared in one of my other videos, Medea. She's going to share it again because it's funny if you didn't see that video. Here's just some of the things that Medea says in her movies, and I love it that Tyler Perry created this character because if you ever want to laugh, one of her movies will do it for you. Anyway, let's get on to all the changes our breasts go through. And there are so many structural changes from perimenopause right through postmenopause that most women, we talk about maybe sagging breasts and how the change of the size, but the transformation actually, it involves the skins, the glands, the fat distribution, the nerves, and the circulation. So there are 15 different changes that our breasts go through, and maybe you've experienced some, maybe you haven't. But the first one is loss of glandular breast tissue. And the breasts contain lobules, which are milk glands, and ducts also. So estrogen is very sensitive to this area, and after menopause the lobules shrink, the ducts narrow, and the glandular tissue gradually decreases. Now when I was pregnant, of course, and I'm sure with many of you when you were pregnant, the breasts got huge. I did breastfeed my babies for the first few months of their lives, and so I know exactly how tender our breasts get, especially during breastfeeding time. And anyway, so yeah, the lobules, they shrink, so all that milk glands just kind of disappear in our breasts when we hit our perimenopause through postmenopause years. Two, the second thing that happens is fat replaces the glandular tissue, and as glandular tissue shrinks, it's often replaced by fat tissue, and that causes the breast to become softer. They feel less dense, and it will increase or decrease in size. So mine definitely decreased. And the third thing is it will lose the upper breast volume. So many women can notice, the upper portion of the breast flattening, and mine definitely did. Seems like a skating rink. Now, instead of something that, was once there, it's all flattened out. But the reason that happens is because the glandular tissue loss, it weakens the connective support in there, and the fat is shifting downward, so then they hang. And the fourth thing is it increased sagging in our breasts. Breasts are supported by Cooper ligaments, and that's and collective fibers, or collagen fibers, sorry. After menopause, that collagen decreases, the ligaments stretch, and the skin elasticity declines. So this leads to definitely more sagging. In one of my recent videos, I said mine are just kissing the dirt now instead of saluting the sun. So yeah, that sagging is all the way down, and the breast tissue just kind of, it's gone, lost, drooped, whatever. The fifth thing is the skin becomes thinner, and the estrogen maintains skin thickness and collagen before, but now that the estrogen declined, the skin becomes thinner, the dermis loses its structure, and the veins become more visible. The sixth thing is breast skin becomes drier, And with the loss of estrogen, it reduces the natural oils that were in our breasts, the hyaluronic acid, and the skin barrier lipids. So this can lead to very dry skin, breast tissue, itching, and increased sensitivity. Now, I know from wearing, a bra all day, when I go to take it off at night, my breasts itch. I never know if it's because of the bra I'm wearing. There's nothing that quite can give me the support I want, because the sagging with the fat hanging, so it doesn't fill out to the top. And so they're just always kind of scrunched in, and I'm small anyway, but it just seems like maybe more skin is in there and not getting the support it needs. The next thing is 7 is changes in the breast density. So before menopause, women had very dense breast, and after menopause, glandular tissue decreases and the fatty tissue increases. So breasts become less dense, and that actually can make mammograms easier to interpret because they're not as dense as they were before. So mammograms can be read, easier now when that happens. The 8th thing is our breasts change in size. You can either become larger or smaller. Mine definitely became smaller. So the reason they become smaller is because of the glandular tissue loss. But if they increase in size, that means there is more fat accumulation going on, and weight gain after menopause often increases our breast size. Number 9 is nipple and areola changes. Some women, the nipples become less firm, the areola slightly flattens, and the color may change, and you have reduced nipple sensitivity. The 10th thing is breast tenderness during perimenopause. The glandular tissue loss, that relates to the weaker connective support and the fat shifting downward. And sometimes they call this empty top appearance. Also, so during that perimenopause stage, you have the fluctuation of the breast soreness, the swelling, and the tenderness similar to PMS. The 11th thing is breast pain may decrease after menopause because hormone cycles stopped. So many women notice there's less cyclical breast pain and fewer hormonal swelling episodes. And the 12th thing is increased breast sensitivity or nerve sensation. So you may have tingling, you may have itching, burning sensation, and random nerve sensitivity. And this occurs due to the hormonal effects on the skin and nerve issues around the area of our breasts. The number 13 is change in breast shape. So this may be they become longer, they become flatter, and they're way lower on your chest. And like in one of the Medea movies, she says they droop to where now she can tuck them into her waistband of her pants. So yeah, that's what I feel like sometimes. I can just tuck them in somewhere else. The 14th thing is fat redistribution in the chest area itself. So menopause often causes the fat storage towards the torso, and it can affect your breast fullness, the underarm fat, and the upper chest fat. Also, number 15 is the structural changes in the breast ligaments, and that is your connective tissue fibers. They lose the strength with age and with the lower estrogen, and that can contribute to the breast drooping and the structural change of the breast. So breasts are not just fat. They contain hormone-sensitive glandular tissue, connective ligaments, skin, and fat. As estrogen declines from perimenopause through our postmenopause years, the glandular tissue shrinks, fat often replaces it, collagen declines, and the internal support system weakens, and that's why breasts often become soft, sag, and change size during midlife. So, I don't know. I guess the whole changing of our hormones, I haven't seen any one good thing come out of it so far except the loss of my period, which I think at this point I'd rather have a period than all of this going on. All right, ladies, if you liked the video, give me a thumbs up. I hope to talk to you again in my next video. I hope you're here to share some of this information with your friends. May you have a wonderful day wherever you are in this world. And love, hugs, high vibrations, and many blessings coming your way. Mwah. Love you, ladies. Take care.